I currently do a couple of types of hair loss treatments in the office, which include PRP as well as Alma TED treatments. Often, my patients coming in for hair loss will also be on supplements, sometimes some oral medications. We also talk about laser caps and things that they could do at home, like shampoos and other things like that. Unfortunately, prior to having GrowTrack, I didn't have any access to anything that could quantify results, which made it very, very hard to really prove to patients that their hair was growing and it wasn't just me taking pictures in a funny way. I think it's very important to have clinical data as well as specifically for hair as well. And that's big, two reasons. One, it's very hard to standardize before and after photos, especially if the lighting in the room changes, the person who's taking the photo changes. And sometimes things can look worse, they can look better, and it's not actually true. And the patients aren't able to pick up those nuances as well. And specifically for hair loss, people want to believe that they're growing hair, and they're skeptical that the treatments that they're having done are growing hair. So to be able to use something like GrowTrack to quantify that information is so helpful because they can see it. There's a numerical value to it, and it's scientifically based. GrowTrack has been pretty easy to onboard, as well as to get used to it. Obviously, initially, it's very different from how we normally take photos. We take them with the DSLR. But once you basically made like a protocol for how you're going to take the photos, it was like 1, 2, and 3. And it's really nice to just be able to see those side by side before and afters, just to see how much change there is at each month when they're coming in. Using GrowTrack, we're actually able to see a huge improvement when we're doing our TED treatments. And obviously patients notice too, but you could see it every month, them growing more and more hair, and not just the hair. It was wonderful to be able to pick up on the ratios of the terminal versus vellus hairs, and then the density itself. So to be able to see like, okay, your baby hairs are turning into the adult hairs, and yes, you're getting more hairs growing in general. I think that was really important for myself and for patients.